A pair of medical marijuana bills are idling in the legislature, and advocates for legislation aren't optimistic about passage, but they're hopeful that a dialogue continues.
I have a granddaughter, Kolbie. She was born with a brain disorder, polymicrogyria, and that's what we're here for. She has seizures more often than not. She sleeps most days. When she's not sleeping, she's seizing. She has a trach and also a feeding tube. When she has seizures, her heart rate goes up. We have to give rescue meds. Sometimes we did get authorization from her neurologist to try CBD oil. It helped, but it did not stop the seizures. It lowered her heart rate, so we don't have that high intensity heart rate to have to give the rescue meds as often. But as she gets bigger, the rescue meds are not working as effective also. She's on 3 different medications currently for seizures, and they're not helping. Kolbie needs access to this medical marijuana, safe access. We just ask for them to put themselves in our shoes. If it was your child, if it was your grandchild that seized constantly in waking hours, wouldn't you want the best for her to have quality of life? That's what we ask for.
Well, if you look at the national, some reports that were put out at Harvard, they found 100 different conclusions. Out of those 100 conclusions, they found 3 solid ones, and that was that cannabis is effective in treating pain, chronic pain, nausea and vomiting from chemotherapy, and muscle spasms in multiple sclerosis, like I suffer from. Well, in the past, I used cannabis, and it positively affected my life. It gave me a better quality of life. I was able to get off of opioids, muscle relaxants, sleep aids. My quality of life increased to where I was able to exercise. I got off of hypertensive medicines because I lost weight. It helped me to become a more active member of society, and really, in all intents and purposes, a better parent. I was no longer the zombie that I used to be with the opioids. I'm no longer walking with a cane. I feel better, you know, and cannabis has a lot to do with that. We're well aware that it's late in the session and there's no chance for a bill to really pass all the way through. We're hoping that Representative Petrie gives it the time in committee to at least have the discussion and the ability to move the discussion forward and that ball just a little bit closer to where patients can get safe access to cannabis.
House Bill 136 is scheduled for a hearing in the House Judiciary Committee tomorrow, but it's not scheduled for a vote, just discussion only.